CEN Prep Questions. Question 1. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 2. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 3. A patient presents with organophosphate poisoning. Which symptoms would the nurse expect? Option A, pinpoint pupils, bradycardia, excessive salivation. Option B, dilated pupils, tachycardia, dry skin. Option C, constricted pupils, tachycardia, dry mouth. Option D, pinpoint pupils, hypertension, excessive salivation. The correct answer is option A, pinpoint pupils, bradycardia, excessive salivation. Organophosphate poisoning causes cholinergic crisis with muscarinic effects, miosis, pinpoint pupils, bradycardia, salivation, lacrimation, urination, defecation, and bronchospasm. Dilated pupils, B, is seen with anticholinergic poisoning. Dry mouth, C, is seen with anticholinergic poisoning. Hypertension, D, is less characteristic. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which of the following is a true statement about do not resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A, it means no CPR. DNR is not a standing order, B. Family, D, cannot write the order but can participate in discussion. Question 5. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 6. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A. Take the medication with milk. Option B. Complete the entire course of antibiotics. Option C. The medication may turn the urine bright orange. Option D. Avoid foods high in tyramine. The correct answer is option B. Complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A. It may cause brown or rust-colored urine, not bright orange. C. Tyramine avoidance, D, is important for MAOI medications. Question 7. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A. Elevated CVP, elevated PCWP, low cardiac output. Option B. Low CVP, low PCWP, high cardiac output. Option C. Elevated CVP, low PCWP, high cardiac output. Option D. Low CVP, elevated PCWP, low cardiac output. The correct answer is option A. Elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 8. Which fracture requires immediate surgical intervention? Option A. Clavicle fracture. Option B. Open fracture of the tibia. Option C. Radial head fracture. Option D. Ankle fracture. The correct answer is option B. Open fracture of the tibia. Open fractures are surgical emergencies that require immediate antibiotics, tetanus prophylaxis, and surgical debridement to prevent osteomyelitis. Clavicle fractures, A, radial head fractures, C, and ankle fractures, D, are typically managed non-surgically or with delayed surgery. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A. Apply fresh water to the area. Option B. Apply vinegar to inactivate nematocysts. Option C. Apply heat to the area. Option D. Rinse with seawater and apply ice. The correct answer is option B. Apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 10. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A. Systemic lupus erythematosus. Option B. Rheumatoid arthritis. Option C. Scleroderma. Option D. Sjogren's syndrome. The correct answer is option A. Systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 11. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A. Inability to abduct the fingers. Option B. Inability to oppose the thumb. Option C. Inability to adduct the thumb. Option D. Decreased sensation in the small finger. The correct answer is option B. Inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 12. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Question 13. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 312 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 14. A patient presents with alcohol intoxication. Which assessment finding is most concerning? Option A, slurred speech. Option B, gait instability. Option C, nystagmus. Option D, decreased level of consciousness. The correct answer is option D, decreased level of consciousness. Decreased level of consciousness is the most concerning finding in alcohol intoxication as it may indicate severe intoxication, hypoglycemia, head trauma, or other co-ingestions. Slurred speech, A, gait instability, B, and nystagmus, C, are expected signs of intoxication. Question 15. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A, respiratory rate of 24 breaths/min. Option B, altered mental status. Option C, temperature of 101.5 degrees Fahrenheit. Option D, WBC count of 15,000. The correct answer is option B, altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24, A, is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 16. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hare, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis. Question 17. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A, apply heat for the first 24 hours. Option B, apply ice for the first 24-48 hours. Option C, begin range of motion exercises immediately. Option D, avoid immobilization to prevent stiffness. The correct answer is option B, apply ice for the first 24-48 hours. For acute sprains, rice, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24–48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing. Question 18. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry minus red skin. Option B, cyanosis. Option C, slate minus gray skin. Option D, flushing. The correct answer is option A, cherry minus red skin. Cyanide poisoning causes a classic cherry minus red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate minus gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 20. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 21. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A, explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B, tell the patient they must undergo the exam to report the assault. Option C, perform the exam yourself to minimize the number of people involved. Option D, delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 22. A patient who is intubated and mechanically ventilated has a sudden decrease in SpO2 from 95% to 85%. The ventilator alarms are sounding with high peak pressures. What is the first action? Option A, increase VO2. Option B, assess for a disconnection. Option C, manually ventilate with a bag-valve mask. Option D, suction the endotracheal tube. The correct answer is option C, manually ventilate with a bag-valve mask. When an intubated patient experiences a sudden drop in SpO2 with high pressure alarms, the immediate action is to disconnect from the ventilator and manually ventilate with a bag-valve mask, BVM. This allows assessment of breath sounds, compliance, and tube patency. Increasing VO2, A, may help briefly but does not address the underlying issue. Suctioning, D, may be needed later. A disconnection, B, would cause low pressure alarms, not high pressure. Question 23. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with POW2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG POW2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 24. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A, anterior dislocation. Option B, posterior dislocation. Option C, inferior dislocation. Option D, superior dislocation. The correct answer is option A, anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare. Question 25. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradocus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradocus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise.